Hi everyone, it's Dr. Tim Whiting of Chiropractic and Wellness Center. We're here in the office today to do a little demonstration of one of the tables that we have. This table is a little unique. You may not see it in many offices, but it's going to start in the upright position and has the ability to lower down flat. So this is good for patients that have a lot of back pain when they come in and may not be able to get up and down normally. So this is an option that we have. It's also used particularly for a technique called Activator Technique, which I'll demonstrate a little bit as we get into it. But first thing, we always grab the face paper to make sure it's nice and clean for the patient's going down. Place it there, have them place their head in, grab onto these handles. Always place my hand on their back as we go down. So we're going to press the pedal, the table's going to go down for me. Again, it takes all the stress off the patient, no strain on their lower back or any part of the back really as they're going down. As you can see, we're finally down, nice and flat. We're going to have the patient bring their hands right up by their sides. So usually when we have them here, we're going to use a certain technique, as I said, it's called Activator. It's a tool that we're going to use. It goes off from what is their foot length. So I'm going to look here. For an example, on this one, it's his right side is short. It's not really that short, but what happens is if you got pain, you've got dysfunction, your body's going to tilt and try to relieve it as best as it can by itself, so it compensates. So we'll see as we go up the spine, you'll have certain areas that are off, and that's what we're trying to correct with this, to level everything off, level the pelvis out, and make sure we're nice and straight. So normally I come over to that side, just for demonstration purposes, so you can see me. I'm going to come over here. This is the instrument. This is called an activator. Instead of doing a hands-on adjustment, I'm going to be using a tool to deliver an adjustment. Again, if they're really acute, I may not be able to deliver a full force adjustment. So this is something nice to have to be able to actually adjust somebody on their first visit if they're in a lot of pain. So as I would work my way up through the protocol, it would show me where I was going to adjust. When I found where I would adjust, place the tool down just like that. There's a button. I'll click. You'll hear a little click. Doesn't hurt the patient at all. It delivers a specific adjustment right through this head where I want it to go to move that area. Again, we work our way all the way up, finding which areas that we need to adjust. When they're all done, always come around, have them grab onto the handles again, so we're going to bring them up. Always place my hand there. Start bringing them up nice and slow. Depending on the patient, I might stop halfway or so just to see if their back can handle coming all the way back up to gravity. Once they're done, remove my hand, remove the face paper, and that would be the end of the adjustment today.